Hello, beautiful people. Welcome back to the channel. I hope everyone is doing well. I am back with new leads that we're going to be talking about. But in today's video, we're doing something slightly different. And the reason I say that is I went digging for some roles that you should be searching for if you are interested in the medical field. We're going to talk about 5 of them. Some of them are entry level. In some cases, you may need certain level of education and even certification, right? So let's talk about them. First one is titled Health Coordinator. So I don't know if any of you guys have heard of them. Telehealth Coordinator, they're basically an individual that is helping to coordinate everything. Teledoc is a good example of them. They do not have a physical location. All of their services are provided remotely. So you can see doctors remotely. Doctors provide services to their patients remotely, pharmacy, etc. So all of these type of services, everything is done remotely. So this individual is going to help coordinate all of the, making sure that the doctor is aware of the certain appointments, how many appointments does he or she have for today, and so forth. And as you can see from my screen, when you go into Google and just type telehealth coordinator, you see Indeed is bringing up approximately 1.4 million telehealth coordinator jobs, which means there is a high demand for this. So I encourage you to go ahead and start searching for this type of title if you are looking to be in healthcare, in the medical field. On average, a telehealth coordinator can earn as low as $35,000 to $60,000 as well. It means that you can get into this as entry level and even remain and grow in this field. We're going to move on to the second one, which is becoming an IRA agent. For anyone that may not be familiar, you are the eye of the blind. You are really providing services from a remote perspective. There are so many ways now, whether it's through you wearing glasses and you are providing that type of service and so forth. But really, you are going to be the eyes of blind. So that's what an IRA agent is, and you're helping them navigate different type of services. You're helping them interact. You're helping them, read through documents and so forth, whatever the need may be. So one of the things I like about being an IRA agent is that you do get trained for this. They're looking for folks that are entry level type of individuals that may not have a lot of experience, but you can potentially grow in it. You can become a supervisor, you can become a manager, you can actually even specialize. That's one of the beauty about becoming an IRA agent. So for this one, I'm actually giving it a 9. Anyone that is interested in becoming one, if you see on here, for example, this is your website, ira.io. So it says here, we are IRA, a visual interpreting service. You can even become certified as you advance in your career. So this is one that I definitely love. So I encourage you to check them out. If you're interested, you just go to their page where it says becoming an IRA agent, and you should be able to apply for the position. See right here, become a visual interpreter. So now hiring, we are growing and looking for great people to join our team. So you can just click apply to become a visual interpreter, and you'll be able to go through the application process. On average, the salary for an IRA agent can vary as low as $40,000 and even high up to 6 figures in some cases. So I think it really depends on what type of experience that you've had, which can potentially earn you more. So that's my second one. And then the third one we are going to be talking about is becoming a medical scribe. So medical scribe, for those that may not know, is really you are just typing for the doctor. So the doctor is in the room, seeing your patients, having conversations, and you're just that individual that is listening in and just typing away as the conversation is happening. Who said what did the doctor discuss with the patients today? And the reason for that is a lot of facilities are gradually moving doctors to this type of setup because it allows the doctor to really spend some time with the patient and not be burdened with taking notes, be burdened with remembering every little detail. Or this individual is going to really be the one that scribes for the doctor. This is one that you can potentially get into with just high school diploma, or in some cases, if you have a bachelor or an associate degree, that is also okay as well. But this is really a position that is very entry level friendly, so you can easily get in without having any experience at all. The salary for my research is between 16 to $25 per hour. That is the salary range on average for this particular role. I encourage you to check it out. I'm giving this one a 7, and that's because of the salary is a little bit low. But overall, I think this is really a good position because I think it allows doctors to have more one-on-one with their patients, kind of relieves them of that burden that I have to take notes. So if you are interested in the medical field, this is one to also keep in mind as you do your search. We're going to move on to the fourth one, which is after hours coordinator. Really, just as the title implies, you are going to be working after hours. So in a hospital setting, they often look for after hours coordinators. They are going to be the ones to make sure all systems are working, to make sure that every schedule for the next day are put in place, etc., etc. So these individuals are very important to make sure that day to day continue to run as smoothly as they should. So when everyone goes home, a lot of things do happen in different jobs. Yeah, sometimes when you come in the morning, there could be issues that arise, but when there are individuals that are placed in those after hour shifts, they ensure that the next people that are coming do not run into issues. They make sure that whatever issues may have occurred during those hours are resolved real time or communicated so that everyone come in ready to go. They are going to be making sure that all that needs to be done from an administrative perspective, so staffing, scheduling, technology, coordination, all of that is important. And they tend to be paid very, very well for this particular role, depending on what you are bringing to the table. In some cases, if you are even licensed as a nurse, you can actually do this also. But because of the flexibility, I am going to give this one a score of a 9 out of 10. Again, the flexibility is there. And secondly, the pay could potentially be very high and so forth. So this is a good one. Then the last one I do have ties in very nicely to the previous one because this one is case managers. So case managers are the people that are managing different care for patients. Sometimes they call them care managers, sometimes they call them case managers. So it can vary. So depending on the organization, but really you are managing the patient from start to finish, especially after discharge from like an inpatient stay to just bringing them back into their communities, integrating them back into their communities. And this could be in mental health, it could also be in medical health. So it really bridges both. So as a social worker, you can become a case manager. As a nurse, you can become a case manager. So really depends. A lot of nurses are case managers because this opportunity, you can work from home, you can work different hours. There's quite some flexibility with this one. So I encourage all my nurses, no matter your level of licensure, this is a good one to definitely think about. So those are the 5. I hope you guys find this information helpful. Please give this video a thumbs up. Subscribe to this channel if you've not subscribed already. And as I always say, remember to have your notification bell turned on so that you are notified in real time whenever I post new leads and so forth. Okay. Till next time, I wish you guys all the very best of luck. Take care, guys. Bye bye.